Alright, okay, so hello dears. Wait lang. Yes, mention wardrobe malfunction. Charot lang. Anyway, alright, so hello again. Welcome to the continuation on our pre-recorded lecture on labeled immunoassays. And for this part, what we're going to discuss now is starting with the third type of labeled immunoassays based on the labels that we use. Diba? We have already discussed radio immunoassay, the first one. Then you have enzyme immunoassays. And then last, third, this one, is your fluorescent immunoassay. All right, so this type of immunoassay was credited to Mr. Albert Kuhns, okay, in the 1940s, yes, 1941. He demonstrated that antibodies can also be labeled using fluorescent molecules, or molecules that can fluoresce. And these compounds are also known as your fluorophores or fluorochromes, okay. And these are organic molecules with a ring structure and has a characteristic optimum absorption range. So they can absorb light, and once they absorb light, if they go back to their ground state, they then emit this light in a much lower energy, Okay? All right, ayan. As mentioned, they absorb energy, which is your excitation energy, and then convert the energy into light of a longer wavelength and lower energy as the electrons go back to their ground state. And the time interval between this phenomenon is quite short, and it can be measured in nanoseconds. Okay, diba? So our little background in your chemistry, again, general chemistry, diba? So muna daghang chemistry sa medtech, charot, okay? Diba? When your electrons are excited, diba? We have orbitals in the atoms. Diba? The electrons move into a higher orbital, but after nila ma-excite, no, mawadan sila energy na po, mubalik sila kung asa sila gikan, char, or mubalik sila sa ilahang ground state, okay? And once they go back to their ground state, the energy that they absorbed, okay, the excitation energy that they absorbed, they will release that back to the environment in the form of light. And that is known now as your fluorescence, okay? And this fluorescence, again, please take note on siyang characteristic, longer wavelength, and of course, lesser energy, or a lower energy. Okay? Please take note. Di ba muna siya characteristic sa imuhang light. The shorter the wavelengths, the higher the energy. Example, mga gamma rays, di ba? They have the shortest of the wavelengths munang highest like energy. Whereas if longer ang wavelength, mas taas, mas gamay ang energy na yang emit. Example, in the case of your ultraviolet, mga infrared, di ba? Or radio waves. They have longer wavelengths, lower ilahang energy. Okay? And that is the characteristic of the fluorescence, the light that your electrons will release after excitation. Please take note. Lumalabas sa boards. They will, gina-ask kay, what type of wavelength energy ang fluorescence or whatever? After excitation, longer wavelength, lower energy. Okay? Alright, ayan. So again, basic chemistry, sana naman na-remember pa. Okay, alright. Now, what are the fluorophores or fluorochromes that we use? These two ang pinaka-common, FITC and SHRITC. Fluorescein isothiocyanate and tetramethylrhodamine isothiocyanate, SHRITC. Yes, most oftenly used. Okay. Phycoerythrin, europium, and lucifer yellow VS. Okay, so these are some of the less common. Pero ang pinaka-common is again, FITC and TRITC. So recall, if maka-remember pa, katong naka-sub ko sa intro to micro ninyo na lecture, back in your second year, maka-remember pa ba? Yes, ang atong grading sa FITC, which I will also show later. Say grading ato, di ba? Atong mga no, apple green, bright, brilliant. Nako, sana na-remember pa. Okay, so review later. Okay, alright, ayan. So these are your typical fluorophores or fluorochromes that we use as labels. Okay, alright, ayan. And here are they. Again, FITC, it's actually apple green fluorescence or green fluorescence. And TRITC is red fluorescence. Okay, alright. Now we go na to the main immunoassay. Again, as mentioned, these are labels. The labels that we use are fluorophores or fluorochromes. And usually, generally, this type of immunoassay is used in detecting antigens on your tissues, no? On prepared tissue slides or frozen sections, yes. Okay, histochemical, yes. Histochemical localization of antigen in tissues. And that's known as immunofluorescent assays. I don't know if, I hope lang na-discuss sa inyo ang histotech na lecture, but this is included, lumalabas din sa boards, mga immunohistochemical techniques, okay? And usually what they use is fluorescence, okay? Fluorescent immunoassays. So again, generally this is used, or this was primarily used at the beginning yun, for histochemical localization of the different antigens in your tissues, because there are a lot of antigens found in your tissues that can be used also for detection of mga cancer, detection of abnormal tissues. Yes. And appeal niya siya, histochemical, immunohistochemical techniques. I'm not sure lang, Jude, if na-discuss sa lecture sa histotech last sem ninyo, but I really hope so. Okay, all right. Again, immunofluorescent assay, qualitative observations involving the use of fluorescence microscope. And again, as mentioned, there are many types of antigens that can be detected either in fixed tissue sections or in live cell suspensions. As I mentioned, this is part of histotechnology, supposed to be ang immunohistochemical techniques, the different mga different antigens that can be detected in your tissues that can be used to detect mga different abnormalities in your tissues. Okay? And nato yung mga, I forgot na good, I hate histotech, no? But the fixatives that you use, diba, you have APES and poly-L-lysine, tama ba? I'm not sure lang if I still remember it correctly, but yes, muna siya. Daghan pa na, there's a lot of immunohistochemical antigens, immunohistochemical stains, yes. Oh my gosh, immunohistochemical stains to use para ma-detect ni siya. So, I hope, sana naman, but yeah. Alright, so again, I could be wrong, Aniha, but yeah. That's included in your histotech, supposed to be. Okay, alright. And again, the presence of a specific antigen is determined again, dark background with a fluorescence. Localized color, the fluorescence, against a dark background. Okay. And again, what is this method used for? Is usually for identification of microorganisms. And as I've mentioned also, tumor-specific. Ayan, tumor-specific antigens on neoplastic tissue, transplantation antigens, and of course, your CD antigens on T and B cells. As mentioned, diba, remember in our lecture on T cell enumeration assays, on cell flow cytometry, diba, they use fluorescent labels, diba, mga fluorescent probes to detect different CD antigens, surface markers on your T cells and B cells, diba? So that they can be identified further. Are they really B cells? What are the CD markers that would identify a cell as a B cell? What are the CD surface markers that would tell you that this cell is an NK cell, diba? Mga ganun. So how do they identify the CD markers? They use fluorescent labeled probes, diba? Recall in our lecture on T-cell enumeration assays. Okay, all right, ayan. So yeah, that's it, fluorescent immunoassay. Again, most of the time it's for antigens yun. Okay, generally, all right? For the tissues. Again, I hope lang yun. Sana naman na-mention. Kahit konti lang naman, sana naman, sa histotech. Okay, all right. So we go na to different types. You have first the direct immunofluorescent assays. So when you say direct immunofluorescent assays, for direct immunofluorescent assays, guys, always take note that ang antigen ang nasa solid phase. Okay? Your unknown antigen is fixed daan on the microscope slide. And aside from that, direct siya, meaning diretso dayon ang iyang reaction. Antigen on the antigen, okay, let's say antigen. Antigen on the microscope slide, unknown antigen. Diretso dayon butangan ni moog ay tao, yes. the antibody na naay fluorescent probe. So the fluorescent probe or the fluorescent labeled antibody it's included in the uptake part, no, or participates in the antigen antibody reaction dayon. Okay? So your antibody with the labeled fluorophore or fluorochrome is added directly on your unknown patient antigen. So antigen atong gidetermine. Okay? So direct ra gyud siya. Munang direct immunofluorescent assays. And after incubation and wash step, you examine under a fluorescent microscope and look at the fluorescence. Okay? Again, as mentioned, it's best suited for antigen detection in tissue or body fluids. And most of the time, again, in immunohistochemical techniques, no, in your histotechnology, for determining antigens on your tissues, usually direct immunofluorescent assays na siya. Okay? Alright. Again, how is it performed? Unknown antigen, patient antigen ba or microorganism antigen, adani mo dayon og antibody with the fluorescent probe, okay? And then examine under the fluorescence microscope. So very easy, straightforward ra ang iyahang procedure, okay? And again, where do we use it? Aside from antigens in tissues and body fluids or body tissues, you could also use it against bacterial agents, okay? Or different pathogens. So Legionella, Pneumocystis, Urovet C, Chlamydia, and RSV. So a lot of pathogens po. Okay? Alright. So again, as mentioned, solid phase antigen. Antigen ang naa sa solid phase. Siya ang gibutang daan. Siya ang unknown. Plus your labeled antibodies with a fluorochrome. You let it react and then examine under the microscope for the fluorescence. Diba? So very easy. Okay, alright. Whereas, for your indirect immunofluorescent assays, by the name itself, indirect. So, kani siya pwedeng antigen or antibody ang naa sa imuhang solid phase. Okay? So, by the name itself, indirect. So, you let first react the patient's serum with a known antigen or antibody ba on the solid phase. And then you wash the slide and then you add another antibody this time. And this is the antibody with the label, the fluorophore label, the fluorescent labeled antibody. Okay? So, mura siya sandwich in a way pa rin. Okay? Alright. So, yeah. So, na-eye washing. Ayan. So, one antibody conjugate, meaning katong imuhang reagent, it can be used for many type of reactions. That's why we don't need a lot of reagent antibodies, diba? Because your labeled antibodies na reagent with a fluorochrome or fluorophore, you can use it to a lot of molecules. So, mas cost-effective, no? And it can also be you can also save a lot, diba? So, ayan. So, and it eliminates the use of different numerous purified reagent antibodies. So, in a way, you could also limit, you could also be more sensitive, okay? All right. So, again, useful in antibody identification. So, we perform this for antibody identification, especially for antibody to treponema. Yes, we will discuss a fluorescent immunoassay in your syphilis serology, yes, in the later part. Anti-nuclear antibodies seen in autoimmune diseases, yes, you will have that in your autoimmunity. You will be discussed on the different nuclear patterns, yes, of staining, so fluorescent staining. You will know, like for lupus, muna siya iyahang, muna ang appearance sa iyahang staining, no, under fluorescent, iyahang nuclear antibodies, whatever. You'll have that in your autoimmune diseases and discussion sa lecture. Okay, chlamydial and toxoplasma antibodies, as well as antibodies to viruses such as HSV, herpes, simplex, EBV, and CMV. Okay, so mostly on antibody detection. So since for antibody detection man ta, so solid phase antigen, ang naa sa imuhang sulod pa rin, and then patient antibodies, and then you then add antigen-antibody combination. But again, as mentioned for indirect immunofluorescent, pwede solid phase antigen or solid phase antibody. Again, depending on what you need to detect. Okay? But for direct immunofluorescent assays, it's best suited for antigen detection yun. Okay? Alright, ayan. So again, back here, antigen-antibody combination. So of course, na-combine sila. Of course, you then wash to remove the unbound antibodies. And then after washing, you then add the labeled which are labeled antibodies pa rin. And then, so mubayin sila sa imong antibodies na mubayin na sila sa antigen-antibody complex, and then you then examine for the fluorescence. Alright? Okay, so that's for indirect immunofluorescence. I hope na gets lang. Okay. Alright, so indirect siya because you let it first react, no? Ang imuhang patient serum, which contains antibody, with a known antigen. Okay, and then after a while, after reacting, then washing na pod, you then add the reagent. So, nagets ra, so indirect siya, dili direct ang reaction. And your reagent antibodies, kaning labeled, wala siya ni participate sa initial antibody reaction o antigen reaction. Okay, it's just, nisunod na lang siya, okay, for label purposes. Alright? Okay, and of course, ayan, how do we interpret the fluorescence of FITC? Please take note, this is from Bailey and Scott's. One of your books in microbiology, lumalabas sa boards. Again, negative, no apple green. 1+, faint yet unequivocal. 2+, apple green. 3+, kay bright. Then, nagpabiyo pa kag intense. So, nahimong 4+, brilliant. Okay? I hope na gets lang. I hope na remember po niyo siya. I introduced this sa second year ninyo, Intro to Micro. Okay, alright. Ayan, negative, no apple green. 1+, faint. 2+, kay apple green na gyud. 3+ bright, okay, but magpabibo pa kag intense, so 4+ brilliant. Okay? I hope na gets lang. Alright. And the last type of your fluorescent immunoassay is your fluorescence polarization immunoassay. And what we detect here is a change in polarization. Wala pa ko nalimot ko sa meaning sa polarization, but I think it's the direction of light that the direction that the light goes or like takes, yeah, after you change something. So basta polarization. Okay, all right. And then in FPIA, labeled antigens, so competitive Japon siya, compete with unlabeled antigens for a limited number of antibody binding sites. So if it's competitive, so therefore, ano gyapon siya? The more antigen, indirectly proportional, that is present, the less fluorescence labeled is bound, and therefore, less ang polarization. So again, the degree of fluorescence polarization, inversely proportional siya to the concentration of the antigen. Sige, we'll discuss that more sa illustration. This technique, limited lang to small molecules that tumble freely in solution. So, dapat molecular weight is under 2,000 Daltons. Daltons ni siya. Okay. And FPIA, it's used mainly to determine concentrations of therapeutic drugs and hormones. So, these are small molecules man, therapeutic drugs and hormones. Okay, so what is the procedure? Incident light, so na light, okay, directed at the specimen, is polarized. So meaning, mo siyang ipaagi og lens or prism. So marag ni different areas, polarized, yeah. So the waves are aligned. Mo siyang i-concentrate. Mo siyang i-concentrate in one plane, polarized in one plane. If a molecule is small and it rotates quickly, so meaning, the emitted light is not that polarized. Okay. Okay. Parang kagets ko. I think because it's too small, no, like mulihok siya pas-pas. So wala kayo light na murag mo scatter or like ma-polarize. Okay, so less ang polarized light. Gets? Okay. Ayan. But if the molecule is too large, okay, and labeled molecule is bound to antibody, so it's unable to tumble as rapidly, so it emits an increased amount of polarized light. Okay. All right. Meaning since dako man siya, no, dako siya. So, dako siya. Dako siya na molecule. So, dili kayo siya mulihok. So, what happens is, if imo siyang sagaon, ang light po na yung ma-produce is straight ra gyud, dili different angles, diba? So, meaning, polarized light, ang polarized light, I think, akong pagsabot niya, is the degree na ang light na in one direction ra. Okay, so, if dako ang molecule, example, antigen and antibody together na complex, so dako siya, di kayo siya mulihok. So meaning, if ang incident light pag-agi niya sa complex, antigen-antibody, dili kayo mo scatter, okay, ang light to different areas. So ang light is one direction ra pod. Meaning, increase pod ang polarized light na ma-produce. So, whereas kung gamay ang molecule, then paspas kayo siya mulihok. So ang light is pwede niya ma-disperse to other areas. So meaning, less ang polarized light or less ang light that goes in one direction. So munang less ang polarized light if gamay ang molecule. If wala ko nasabi sa akong pagsabot, I will read about polarized light po dun sa pasabot niya. But that's how I understood. Okay, sorry. The degree of polarized light again reflects the amount of labeled analyte that is bound. Okay, let's say inani siya. Little or no patient antigen, so meaning more polarization. Why? Because so you're labeled, di ba? Okay, so you're labeled ang mo attach sa imong antibodies. Okay? All right. So tama. So you're labeled ang mo increase imong labeled antigens kato na fluorescent ang mo attach sa imong antibodies. So therefore dako na molecule, right? Dako na molecule. So therefore pag ana sa incident light, so na may dako na molecule, so therefore ni ang label pa jud ang nidaghan dito. So meaning paghayag, no, pagsiga nimo sa imuhang immune complexes, di ba? What did we say? If dako ang molecule, example, antigen antibody complex, therefore mas increase po ang polarization. Gets? So meaning diri dapita, since mas daghan man ang ni-bind sa antibody na bound na labeled antigen, so therefore increase ang polarization brought about by the reaction of your labeled antigen, okay, with your antibody na reagent. Gets? Whereas, if little pod ang imuhang patient antigen, okay, the free label here, di ba, since mas daghan mang label ang wala nakabind, it decreases now the polarization. Why? Because these molecules are small, okay, di ba? So, mas daghan man sila, so, mas mo rotate, di ba, rapidly. Di ba? If mo tumble sila rapidly, therefore, they decrease the polarization. Alright? So, inversely proportional gapon. So, if increase ang polarization, less ang imong patient antigen. If decrease imong polarization, meaning increase imong patient antigen. Na-gets? Okay, I hope na-gets. Alright, okay. Ayan. Okay, now for the advantages, again, fluorescence, high sensitivity and versatility, ay versa siya. Yes. Simple methodology, and there's also no need to deal with hazardous substances to deal or to dispose harmful substances. The disadvantage lang is that you need to separate the signal on the label from autofluorescence. Okay, so like there are some organic substances that they release their own fluorescence. So you need to remove that. Okay, pwede siyang misinterpret. Okay, like the fluorescence that is coming is not from the reagent or the reaction, but it's because of the inherent capability of the substance to fluoresce. Okay, so you need to separate those, parang ganun. Okay? Difficulties also to non-specific binding to substances in serum that can cause quenching. So for fluorescence test, guys, always remember, take note ba sa mga fluorescence, the main disadvantage ko nila is quenching. So please take note of that. Lumalabas din sa boards. The main disadvantage talaga. So when you hear about mga fluorescent tests, fluorescent immunoassays, the main disadvantage is quenching. So when you say quenching, there are some substances that in your organic substances, example, in your serum or in your area that could quench. So when you say quench, iyahang palungon or iyahang kuwaon ang light. Okay? Or mawala ang fluorescence because of quenching. Okay? So ma-diminish, yang i-diminish or eliminate even the fluorescence that was produced. So if wala na yung fluorescence na ma-detect, so ma-false negative. Okay? Alright. And for FPIA or FPIA requires expensive, dedicated instrumentation. Okay, for FPIA, always take note that there is labeled antigen, di ba, fluorophore. So, muto siya ang ma-detect sa light. Okay? Not necessarily the patient antigen. Di ba? Because what we're looking for, what we're measuring is the labels. And once we measure the labels, it then tells you the concentration of your unknown, may it be antigen or antibody. Di ba? That's the general rule of your labeled immunoassays. Okay? Alright, so that's for... medyo maraming chika. Okay, that's for fluorescent immunoassay. Okay. And for the last type of labeled immunoassays is your chemiluminescent immunoassays. Okay, so what are these? By the name itself, chemiluminescent, chemiluminescence is the phenomenon, no? The emission of light brought about by a chemical reaction, generally or most of the time oxidation reaction, which then produces a light. No? Excited molecule, same gapon sa fluorescence, that decays back to its ground state. And once it goes back to its ground state, it releases light, okay, and that is now chemiluminescence. The difference lang is that it's a chemical reaction. Ang fluorescence man good is it's a molecule itself, good, that releases light, okay, once ma-excite siya. So it doesn't need a chemical reaction. It's the molecule itself na kung hayagan niyo siya, hatagan niyo siya incident light, ma-excite, okay, then after a while, mubalik to ground state ang electrons, mo-release siya og fluorescence. Whereas for chemiluminescence, you have a molecule and then kailangan mo siyang i-react pa with another, usually oxidation reaction, to produce the light. Okay? Alright, and the common chemiluminescent molecules, you have luminol, acridinium esters, ruthenium derivatives, and nitrophenyl oxides. Okay, alright, so this is the molecule. So chemiluminescent molecule plus H2O2, in the presence of an enzyme catalyst, oxidized chemiluminescent molecule plus H2O. Alright. Alright, okay, so again, balik ta sa principle, no? So this is the general reaction. So let's say, as mentioned, your labels, this one, kani sila, alright? These molecules are your labels. Now, they can be added to either antigen or antibody. So reagent, antigen, or antibody. That would again depend kung unsay mong ganahang i-detect. Do you want to detect the antigen from the patient? So you use a reagent antibody. Or do you want to detect the antibody from the patient? So you use antigen or reagent. Okay, so what happens is, let's say you're detecting the patient's antigen. Okay, all right. So in a test tube daw, this is in a cuvette. Okay, cuvette. Of course, so you have a solution. So let's say you have the reagent antibody. Okay, all right. And then you have also here, tama. You have the antigen. Okay. This is the tama. You're detecting the body's the patient's antigen. Okay, sige. So this is the patient's antigen in your sample, and then this is the reagent antibody. So of course, react sila together. React sila initially. Okay. Okay, ayan. Then after a while, of course, na po dahil washing mahitabo. Okay? Alright, so you remove the mga unbound antibodies. And then next is, of course, you add now the labels. Let's say luminol. So your luminol is another antibody with luminol. Ayan. Okay. So, gi-add na dahil yun, and then still the same, after a while, you then wash, okay? And then, once na-wash na, you then add your H2O2, which is your oxidizer, okay? And then, also the catalyst, okay? So, this is put in a cuvette, okay? And then, imong gisulod sa machine. So, ang machine na mo add, I think, sa oxidizer and catalyst. Okay, and through that, now that it has already, you have given the necessary requirements, diba, for the reaction, for this reaction to occur. So what happens is the luminol, okay, will now be oxidized to a molecule, a chemiluminescent molecule. All right. So the luminol will now give off light because of this reaction. Okay, and this light is now what we observe. So what do you think ang iyang proportionality? Diba, it's still direct proportional, direct proportion, yes, direct proportion. So kung mas taas ang light, of course, mas taas po ang patient antigen or antibody. Why? Because it would indicate that more of the labels are used because more of the antibody or antigen from the patient sample is there. Okay? Alright, ayan. So again, where can we use it? For therapeutic drugs, steroid hormones, and protein hormones. Again, most of I've experienced, I think, sa IS, mostly sa Galyares, kaya nasa machine, architect, they use ECLIA, enzyme chemiluminescent, if I'm not mistaken. ECLIA or CLIA lang, Chemiluminescent Immunoassay. Yes, chemiluminescent. Yes. Alright, so that's for chemiluminescent immunoassays. And for its advantages, excellent sensitivity, comparable to EIA, enzyme immunoassay, and RIA. Reagents are stable and non-toxic. Quite inexpensive to perform because very little reagent is used. High speed then of detection, meaning faster po ang turnaround time, meaning mas paspas po mahuman imuhang tests, mas paspas maka-release of results. That's good, okay? And detection systems consist of photomultiplier tubes, same sa imuhang, because again, you're detecting light, okay? And they are simple and relatively inexpensive. But for the disadvantages, false results may be obtained pa rin if there's a lack of precision in the injection of H2O2 in your oxidizer, if dili tsakto ang pagsulod sa H2O2, or if some biological materials, as mentioned, because again, this produces light, that could quench the light emission. So when you say quench, nung nasa word na daan, just think about it, quench. Mura siya iyahang walaon ng light, pero iyang purgahon, something like that. That's how I think about it. Okay, so that's generally one of the main disadvantages, if not the main disadvantage good, og mga immunoassays or tests that depend on light production, that depend on the measurement of light production, yes. Quenching, fluorescence, chemiluminescence, yes. Quenching. Again, the removal, the elimination, the diminishing of light produced by either fluorescence or chemiluminescence by different materials found in the serum, in the sample, or other unwanted materials that could quench, no? That could eliminate this light or diminish this light. Okay, all right, parang yes. Darkness and light, yes, parang ganun. Okay, all right. And basically, yes, that's the end. Thank you, Father. Thank you, Lord. Yes, naka-survive na dyan ko na lecture. But the question is, na ba mo yung nakatunan that is yet to be answered? I hope lang yun na. And I hope na explain po na ako sa tarong, no? Again, this is one of the topics in IS that I find it very, 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 very frightening to lecture and to talk about. Because again, quite complex ang topics, no? Again, medyo gihangak pug ko discuss medyo gihangak ko discuss ato, no, but I really hope lang gyud na you learned something and then you understood with the complexes. As I mentioned from the start of the lecture, always the illustrations by Sir Jemu, the one that he provided here, which can also be seen in your books in Stevens or Erturgeon, can really help for you to understand. Okay? And I hope lang you learned, please. Okay, thank you. All right, I really hope that you learned something and that I was able to impart what I needed to impart and that I discussed this lesson properly. Okay? All right. So we're almost done with the second semester. We're almost done with our class in IS Lab. And again, my ultimate goal lang yun is at the end of this class, you can say na, yes, I have retained something. I've learned something. I will take this with me when I become a professional soon. Char. Okay, all right. But yes, so again, dears, that's all for labeled immunoassays na discussion. Again, this is one of Kuya siya sa precipitation agglutination reactions. These are types of immunoassays, okay? All right. And after these, the lectures that we will have are the diagnosis of diseases na that employ these types of immunoassays, these types of labeled immunoassays. All right. So again, these are all our discussion, or this discussion that we have, our lecture for the labeled immunoassays. I hope lang yun, again, as mentioned, that you learned something. If you have any questions, again, please feel free. Ayaw nagkaulaw. Uy, hapit na mo ng SEM. Maulaw pa mo. Char. Do not be shy to chat me or chat in our group chat for your questions. Okay, and I'll see you on our next remaining pre-recorded lectures. Gamay na lang yun. Okay, mama ng SEM. Yay. All right. And yeah, thank you again for watching, dears, and for listening. Again, have a great day. Have a great day and keep safe. Laban lang dyan. Okay? All right.